Hello, and welcome to today's session. Previously, we talked about history of mental health, anxiety, and depression. Today, we are diving into the subject of schizophrenia, which is another mental health condition that is often misunderstood and surrounded by fear, myths, and stigma. The goal of this presentation is not to diagnose anyone. Instead, it's to educate, to reduce fear, and to help people better understand what schizophrenia really is, how it affects individuals, how to recognize possible signs, and most importantly, how we can support people who live with it. Busy Mind believes that when we replace fear with understanding and judgment with compassion, we create safer and more supportive communities for everyone. So let's begin by trying to define schizophrenia. Schizophrenia is a long-term mental health condition that affects how a person thinks, feels, behaves, and experiences reality. For example, people with schizophrenia may have difficulty telling the difference between what is real and what is not. This can affect their thoughts, emotions, relationships, and ability to function in daily life. It is really important to note that schizophrenia is a disorder of perception and thinking, not identity. What causes schizophrenia? There is no single cause of schizophrenia. Instead, it usually develops due to a combination of factors. First, there are biological factors. Schizophrenia can run in families, suggesting a genetic component. There are also differences in brain chemistry and brain development, particularly involving a chemical messenger called dopamine, which plays a role in perception and motivation. Second, there are environmental factors. Stressful or traumatic life events, complications during pregnancy or birth, and substance use, especially cannabis or stimulant drugs during adolescence, can increase the risk. Third, there are psychological factors, such as chronic stress or difficulties coping with emotional challenges. It's important to emphasize that having one or even several of these risk factors does not mean someone will definitely develop schizophrenia. Many people experience these factors and never develop the condition. Symptoms of schizophrenia. Symptoms usually appear in late adolescence or early adulthood, and they can vary widely from person to person. They are often grouped into three main categories. Positive symptoms. These are symptoms that involve experiences added to normal functioning. They include hallucinations, such as hearing voices, which is the most common experience. They can also include delusions, which are strong beliefs that aren't based in reality. For example, feeling watched, controlled, or persecuted. Disorganized thinking, unusual speech patterns, and unpredictable or agitated movements may also occur. Negative symptoms. Negative symptoms involve a reduction in normal abilities. This may look like low motivation, reduced emotional expression, social withdrawal, difficulty enjoying activities, or neglecting personal hygiene. These symptoms are often misunderstood as laziness, rudeness, or lack of interest, but they are part of the illness, not a personal choice. Cognitive symptoms affect thinking skills. People may struggle with concentration, memory, planning, or decision-making. This can make school, work, or everyday tasks much more challenging, even when other symptoms are under control. How does schizophrenia affect people's lives? Schizophrenia affects everyone differently, but it can impact relationships, education, employment, and independence. Many people also experience anxiety or depression alongside schizophrenia. For some, the hardest part isn't only the symptoms, it's the stigma and misunderstanding from others. Being judged, feared, or excluded can be incredibly damaging. It's also important to challenge a harmful myth. People with schizophrenia are far more likely to be harmed than to harm others. The idea that they are dangerous is not supported by evidence and only increases fear and discrimination. Early warning signs to watch for. Before full symptoms appear, there may be early warning signs, sometimes called the prodromal phase. These can include withdrawing from friends or family, declining performance at school or work, changes in sleep or appetite, increased suspiciousness, unusual beliefs, difficulty thinking clearly, or becoming emotionally distant. If these changes last for weeks or months and continue to worsen, it's important to seek professional help early. Early intervention can make a significant difference in long-term outcomes. How is schizophrenia treated? While schizophrenia is a serious condition, it's also important to know that with the right treatment and support, many people with schizophrenia live meaningful, productive, and fulfilling lives. Schizophrenia is usually managed with a combination of treatments. Medication, particularly antipsychotic medication, helps reduce symptoms such as hallucinations and delusions. Psychological therapies, including cognitive behavioral therapy and supportive counseling, help people understand their experiences, manage stress, and develop coping strategies. Social support is also crucial. Stable housing, employment or education support, family involvement, and community programs all play a major role in recovery. Recovery doesn't always mean symptoms disappear completely. It means learning how to manage them and live a meaningful life. How to support someone with schizophrenia. If someone you care about has schizophrenia, your support truly matters. First, educate yourself. Understanding the condition reduces fear, frustration, and misunderstandings. Second, be patient and calm. Avoid arguing about hallucinations or delusions. Instead of challenging their beliefs, focus on their emotional experience. For example, you might say, "I can see that this is really distressing for you." Third, encourage treatment gently. Support appointments and medication without forcing unless there is immediate danger. Fourth, create a stable, low-stress environment. Predictable routines and emotional safety can make a big difference. Fifth, watch for signs of relapse, such as changes in sleep, increased withdrawal, or stopping medication. Early help can prevent symptoms from becoming more severe. And finally, take care of yourself too. Supporting someone with schizophrenia can be emotionally demanding. Setting boundaries and seeking support for yourself is not selfish, it's necessary. When to seek urgent help. Immediate professional help is needed if the person is at risk of harming themselves or others, is extremely confused or distressed, or is unable to care for themselves. In these situations, contacting emergency services or mental health professionals is the right and responsible step. We're coming to an end of today's topic by emphasizing schizophrenia is a serious but treatable condition. Also, that with understanding, appropriate medical care, and compassion, people with schizophrenia can and do live full, meaningful lives. Busy Mind believes that education reduces stigma, empathy builds connection, and support can truly change lives. Thank you for listening. If you found this presentation helpful, please consider sharing it to help spread awareness. Take care.